Hi, I'm Dr. Ako. I'm a board certified family medicine physician in Texas. Welcome to my channel. This is our third video on diabetes. The first video was an overview. The second video was a comprehensive review, and this is more of an in-depth review. So what is diabetes? Diabetes is a chronic condition where the body is not able to produce enough insulin, or the insulin that has been produced is not able to be used effectively. This leads to high levels of sugar or glucose in the blood. What is insulin? Insulin is a hormone that's secreted by the beta cells of the pancreas, and it helps glucose to enter the cell so that this glucose can now be turned into energy for cell function. Without enough insulin or proper insulin action, glucose will build up in the blood and in the cells. Let's go through the different types of diabetes. There's type 1, type 2, gestational diabetes, and prediabetes. This next slide is a summary table of the different types of diabetes, some of the key features, the description, what age group is being affected, and how a diagnosis is being made. We're going to start with type 1 diabetes. So type 1 diabetes is known to be an autoimmune disorder, which is secondary to destruction of the beta cells of the pancreas. These are the cells that are responsible for producing insulin. It tends to affect children, teens, young adults, and it tends to have a sudden onset. Patients with type 1 diabetes usually require lifelong insulin. There's also a high risk for ketoacidosis. Ketoacidosis is a secondary process where the body is not able to use the glucose, and so the liver will dump fat or lipids into the blood, and the body tries to break that down to get glucose, and a byproduct of that process is the rapid buildup of acid in the blood. And this condition is actually very serious and can be fatal if not treated on time. The diagnosis of diabetes is made with a diagnostic test called an A1C, and this A1C level needs to be 6.5% or higher. There's also fasting glucose tests that can be done, but are not used as a definitive diagnosis for diabetes, because these numbers can be altered based on whether a patient is fasting or not. And the next type is type 2. This is more common in adults, even though it's increasingly more common in children also. And it's often associated with a sedentary lifestyle or obesity. It tends to have a more gradual onset, and most patients tend to be asymptomatic in the very beginning. And this is caused by insulin resistance. So these patients have insulin, but the body is not able to use that insulin effectively. And the diagnosis is also made with an A1C test, and that A1C needs to be 6.5% or higher. This is our next slide, and we're going to talk about the third and the fourth types of diabetes. So prediabetes is a condition where patients have high blood levels of glucose, and these levels are higher than normal, but not high enough, to be considered as diabetes. It's often reversible with lifestyle changes. There are millions of Americans who have prediabetes. It tends to be undiagnosed. Who's most at risk? It's adults with obesity, inactivity, family history, and this prediabetes can also be diagnosed with an A1C test. The A1C level is usually between 5.7 to 6.4%, and the fourth type is gestational diabetes. It tends to occur in pregnant women with no prior history of diabetes or diagnosis of diabetes, and the blood sugar levels are seen to be high during pregnancy. This usually occurs within the second and the third trimester, And gestational diabetes can be diagnosed with a 2-hour oral glucose tolerance test. An A1C test is usually not used for its diagnosis. And it's important to diagnose gestational diabetes because it increases the risks of complications for both the baby and the mother. And it can resolve postpartum, but sometimes it progresses into, type 2 or type 1 diabetes. All right, so on this slide, we're going to be talking about the different types of diabetes and the reversibility factors, the symptoms, as well as the risk factors. So with type 1 diabetes, lifelong insulin injections are usually required. It's not reversible. Most common symptoms is frequent urination, increased thirst, weight loss, fatigue, and ketoacidosis, like I described earlier, is a possibility. And the risk factors include, genetics and an autoimmune history. With type 2 diabetes, treatment usually entails lifestyle changes, oral meds, and insulin if the A1C is very high, usually above 10 or 11. And type 2 diabetes can usually be delayed or controlled. The symptoms are often mild or absent at first, but many patients will complain about fatigue or blurred vision, or will end up having frequent infections. Risk factors include obesity, a sedentary lifestyle, age, family history. The third type we're going to look into is prediabetes. This can be treated with lifestyle changes, so a low carb diabetic diet, exercising, weight loss, and for some, maybe initiation of oral medications like metformin. And this, patients with prediabetes usually have no symptoms, and the risk factors are usually the same as with type 2 diabetes. So obesity, a sedentary lifestyle, people of a certain age, and family history. And so what are the action steps? The one main action step for everybody is, go to your primary care physician and ask for a hemoglobin A1C test to be done. And that's all that needs to happen. Encourage family members and friends to be tested also, because about 1 out of 3 people have diabetes, and prediabetes, which has been undiagnosed. So this is a slide where we're talking about action steps. So first we start by checking a hemoglobin A1C. If the A1C is equal to or higher than 6.5%, then a diagnosis of diabetes is made. If the A1C is less than 6.5, it can either be an absence of diabetes or the presence of prediabetes. So for patients to be diagnosed with prediabetes, the A1C has to be between 5.7% to 6.4%. For patients who do not have diabetes or prediabetes, the A1C is usually 5.6% and lower. And so I'm going to talk a little bit more about type 1 diabetes. I'm just going to give an example. Let's say you went into your provider, physician, and your A1C was checked and it came back to be about 16. And all the other risk factors align as far as age and incidence. You're usually going to be started on insulin, and the insulin is usually a pre-meal insulin, long-acting insulin, and this is calculated based on your weight. And an A1C usually will be checked every 1 to 3 months until it gets to goal. On the other hand, there are other changes that need to be made, usually lifestyle changes and risk factor evaluation. So lifestyle changes will include, starting you on a cardiac diabetic diet. The diabetic diet is, a diet that's, void of carbs or has very little carbs, or it has, foods that are considered to have a low glycemic index. And it's also a cardiac diet would be like a low-fat, low-salt diet. Recommendations would be made for starting exercise, so brisk walking. It's usually 30 minutes a day, 5 days a week, or 150 minutes a week at the minimum. And an evaluation for other risk factors needs to be started with also, and this includes an evaluation for risk factors for heart disease, and evaluation for risk factors for kidney disease, for eye disease, for liver disease, for peripheral arterial or peripheral vascular disease, as well as, and evaluation of the patient's medical history to see if there's any sort of tobacco abuse. I'm going to make another video because, with these risk factors, we also will go into what is called a cardiac risk calculator, and it's pretty in-depth. So I'm just going to make another video so we can talk about that some more. For patients with type 1 diabetes, GLP-1s are usually not approved because, the combination of insulin and GLP-1s highly increases the risk for hypoglycemia. On this slide, we're going to talk about type 2 diabetes, and this is just a theoretical example. So let's just say, for example, you went to get your A1C checked and it came back with an A1C of 11, and you happen to fit the right demographic, sedentary lifestyle, older patient, obese. So you would be started on insulin because of the degree of severity or advanced diabetes that's seen here, because with oral meds it could take years to get your A1C down to under 6.5, and during that time there's going to be continuous progression and destruction of your heart, your kidneys, your eyes, your liver, your blood vessels. And so the goal is to try to get the A1C down as fast and as safely as possible. So usually we'll start you on an insulin which is weight-based, and in addition to that, you'll be started on an oral medication. The oral medication is usually metformin, even though there are many other oral medications that could be used and tailored based on your personal medical history. Okay, and usually we'll want to check an A1C every 1 to 3 months until we get it to goal. For type 2 diabetes patients, we'll also want to start them on a cardiac diabetic diet. Seen here, it's a low to no carb diet, a low fat, low salt diet. Lifestyle recommendations are also going to include exercise, walking 150 minutes a week at the minimum, as well as evaluation for heart, kidney, eye, liver disease, peripheral arterial disease, and a medical history to evaluate for tobacco use or abuse. And like I said earlier, I'm going to go into a whole video to talk about the cardiac risk calculator and how we use it to determine the patient's risk for a heart attack or a stroke, and what are the next steps once we get that score. For people with type 2 diabetes, medications like GLP-1s are approved in this group, but should be started, once the A1C is much lower because of the risk of, blurry vision secondary to a sudden drop of glucose levels, because between the GLP-1s and the insulin and the oral meds, the sugars can drop really quickly. All right, so on this slide, we're going to talk a little bit more in detail about prediabetes. So prediabetes is diagnosed when the A1C percent is between 5.7 to 6.4. These patients are typically, recommended to start a lifestyle change, which includes an exercise regimen, walking 30 minutes a day, 5 days a week, so 150 minutes a week at the minimum. A diet change, which includes starting on a cardiac diabetic diet, which is usually a low fat, low salt and low to no carb diet. They can also be started on oral medications like metformin. This is typically done at a lower dose, such as 500 milligrams once a day. And the A1C, can be checked as needed, every 3 months, every 6 months. And if we're wanting to be more aggressive, it can be checked every month as a point of care test in clinic. And evaluation for all other risk factors is also started at this time. So risk factors would still include heart disease, kidney disease, eye disease, liver disease, peripheral arterial or peripheral venous disease, as well as review of a medical history to see if there's use of tobacco. Medications like the GLP-1s are not approved in this group, but other weight loss medications such as Zepbound or Wegovy can be considered for people with obesity. This slide is talking about gestational diabetes. So gestational diabetes is typically diagnosed in pregnancy, during the second to the third trimester. And it's not usually diagnosed with an A1C. It's diagnosed with an oral glucose tolerance test, which is conducted over 2 hours. For these patients, the recommendations are the same. Start on a diabetic diet or a low-carb diet, and sometimes medications or insulin can be recommended. Pregnant women can exercise and increase exercise as tolerated. Postpartum, once these women have had their babies, an A1C test is going to need to be completed to screen the patients for diabetes, and A1C tests need to be conducted regularly after that. We've now come to the end of our video on diabetes. I hope I've been able to provide a better understanding of the different types of diabetes for you. Take action. That's the main goal of this video. Schedule your next appointment today, tomorrow. Get your A1C test done. Like I said, millions of Americans have undiagnosed diabetes and prediabetes, and the disease will continue to progress and may put you at risk for a heart attack, a stroke, kidney failure, liver failure, blindness, and amputation. And this video is for informational purposes only and does not constitute or substitute professional advice. Please seek health advice from your primary care providers, and let me know what questions you have in the comments below. Thank you. Let me know what other topics you would like me to review. Please subscribe to the channel, like and share the videos if you've enjoyed the content I've provided so far. Thank you.